for purposes of this verbal testimony, I'm going to talk to you about managed care. I'm going to tell you that for the last 10 years, mental health and substance abuse services have been carved into the state's Medicaid managed care program. New York is paying $400 million a year to 15 insurers who are contracted with the state. They are primarily for-profit corporations that are housed outside of New York State, and they are in charge of and have a conflict with what they're hired for, which is to arrange care for these Medicaid members. And the game is to delay and deny care, to delay and deny payment, such that insurers can bank the money, earn interest on it, while we wait for payment, while waiting lists are abundant across New York State, while when an individual in New York with a substance use condition gets a denial from an insurer, and they go to an outside external appeal process, in 64% of those cases, they are overruled. The insurer is overruled. The delay and deny tactics that are employed by insurers who are motivated by profit, not by people, is a huge conflict of interest. We've been in it 10 years. We've done our time. This is a quagmire we have to get out of. The claims denial rates by insurers for mental health services is 60%. In the fee-for-service domain, it's 20%. We can, together, make a stab at $400 million in savings that I mentioned earlier by firing the insurers, removing them from this triangular situation, and reinvesting the money in our systems of care to ensure that gaps in care are addressed, to ensure that you have the money to deliver the workforce TII that you want to deliver. This is a tremendous problem in our system. We're asking for your help. I don't have any more time. Please ask me about the COLA. Okay?
Senator Fernandez.
Thank you so much. And Ms. Cole, I will give you my 3 minutes. Please
my
tell me about
gosh,
this
thank
COLA.
you.
Tell me about this bill.
So, each year you come here and you fight like dogs to get us a COLA, TII, along with the governor. And together we do something rather extraordinary every year. I'm telling you that the money that you legislatively intend to get to providers sometimes doesn't get to them for years. And it's not just a broken contracting process, not by any means. It is a failure by insurers to pay the correct rate on time and in full, as is the law. So your legislative intent is in question. You mean for that money to get into our pockets. It doesn't, very often for a very long time. The other thing I want to tell you is that in 2023, the Attorney General's office did a Ghost Networks secret shopper survey and found that the directories that we all look at when we're looking for practitioners, 86% of those entries were incorrect. Either the practitioner didn't exist, didn't accept Medicaid, or whatever. This is unacceptable. This is out of control. We have $400 million at a minimum at risk that can be redirected and should be redirected into our systems of care immediately. Governor's budget was silent on this matter. We ask that you not be silent. We have bills. We have two same-as bills. Assemblywoman Simon and Senator Brooke are sponsoring our bills. Please, please include this in your one house.